Welcome to Orvos Healthcare HIPAA Training. HIPAA is the Health Insurance Portability and Accountability Act. Passed by Congress in 1996 and implemented in 2003, HIPAA regulations were designed to protect individuals' rights to privacy, confidentiality, and to ensure the security of electronic transfer of personal information. HIPAA applies to us all, in all settings. So why do we have HIPAA? HIPAA was created based on genetic advancements, marketing, and technology. Genetic advancement created the possibility of a company knowing about the predisposition of a patient. If a company knows a patient's genetic makeup and that they may possibly develop MS, the company may be inclined to deny coverage. HIPAA was also created to prevent individuals from receiving unsolicited marketing material based on data mining your private health information, or PHI. Due to overwhelming use of technology, HIPAA was implemented to protect the transmission of data between providers and from the general public. What objectives do the privacy regulations accomplish for patients? 1. They give patients more control over their healthcare information. 2. They set boundaries on the use and disclosures of health records. 3. They establish appropriate safeguards for all people who participate in or are associated with the provisioning of health care to ensure that they honor patients' rights to privacy of their PHI. 4. Hold violators accountable. And lastly, 5, protect PHI. Some common words or abbreviations used in dealing with HIPAA are private healthcare information, or PHI, protected medical information, or PMI, privacy officer, PO, covered entity, CE, and accounting of disclosure, AOD. So, what are the 7 patients' rights regarding privacy of PHI? Number 1, receiving notice of an agency's privacy practices. Number 2, knowing that an agency will only use PHI for treatments, payments, operations, and other certain permitted uses as required by law. Number 3, consent to use and control the disclosure of their PHI. Number 4, access their PHI except for psychotherapy notes. Number 5, request amendments or addendums to their PHI. Number 6, receive accounting disclosures. Number 7, file privacy complaints to agency offices. The sharing of PHI is strictly prohibited without written permission from the patient. Examples of things that are not permitted are names of patients on antihypertensive drugs cannot be released to a company marketing nutritional products to lower blood pressure. In addition, names and addresses of pregnant women cannot be provided to infant formula companies. And lastly, contact information of previous patients cannot be used to help raise money for a hospital building campaign. Who should have access to PHI? PHI should only be shared with a few individuals, as many as needed. The physical therapy assistant needs to know only the facts concerning a patient's current condition. If you have questions in regard to who has access to PHI, you should ask a provider. How should you protect your patient's PHI? Take all responsible steps to make sure that individuals without the need to know don't overhear conversations about PHI. Do not conduct discussions about PHI in public or common areas or outside of the workplace. Do not let others see your computer screen while you're working. Be sure to log out when done with any computer files. Protect your printer outputs from anyone that may be around that does not need to know PHI. When you've created PHI, you need to destroy it in the proper method. Do not put notes with PHI or PMI on stickies around your desk. And be sure if you need to destroy your PHI, you shred it. Do not put it in the wastebasket or any recycle bin. HIPAA violations are very serious, and any HIPAA violation should be reported to your supervisor. Consequences of HIPAA violations can be very serious, to include civil or criminal penalties, fines, plus imprisonment, or professional consequences, such as disciplinary actions by respective licensing boards. Thank you for taking the Orvos Healthcare HIPAA training.